Welcome to the deep dive. We're here to cut through the noise and get you well informed. Today, we're diving into a really fascinating bit of public health. We're looking at the theories, or maybe the lack of them, behind collaborative approaches like co-creation, co-design, and co-production. Our mission, really, is to figure out why understanding the theory behind these is just so crucial for making public health work better for you.
Absolutely. It's vital stuff. Public health, it's all about preventing disease, promoting wellness, keeping people healthy. And these co-approaches are getting a lot of attention, seen as powerful ways to get everyone involved, stakeholders, community members, people just like you. The idea is you get more relevant knowledge, better solutions tailored to actual needs.
Okay, right. So let's unpack that. Because we hear these terms, co-creation, co-design, co-production, kind of thrown around a lot. They sound pretty similar. And, well, often they are used as if they mean the same thing. But the systematic review we looked at, it really pushes for clear differences. Could you lay those out for us?
Yeah, happy to. It's helpful to get that clarity. So co-creation is the big one. Think of it as the overarching philosophy. It's about collaboration, solving problems innovatively, involving different people across all the stages, from figuring out the problem right through to checking if the solution worked, building it together, basically.
Got it. So co-creation is the big umbrella. How do the others fit under it then? Co-design and co-production.
Right, so co-design is more specific, still collaboration, absolutely, but it focuses squarely on designing the solutions. The problem's already sort of set, and you're working together on the how. How do we tackle this? Then co-production is, well, it's about the doing, engaging people in actually implementing the solutions that were decided on, often with a focus on making the best use of, resources, collective action to make the plan happen.
Okay, that makes sense. Much clearer now. Co-creation overall, co-design for the planning, co-production for the action. But here's where our review got, well, really eye-opening. Quite surprising, actually. Despite all this interest, all this talk about using these approaches in public health, the review found something pretty stark. Get this. Out of almost 4,000 unique references they looked at between 2012 and 2022, only 10, just 10 articles explicitly used named theories to support these co-approaches.
10, it's a tiny number.
It really is. The review calls it a clear lack of explicitly named theory support, a huge gap.
And the implication there is significant. Think about it. If you don't have an explicit theory, a clear why and how, it's like building something complex without any blueprints, right? You might stumble on something that works, maybe, but you won't really know why it worked. You can't reliably repeat it or adapt it when things change. Theory gives you that structure. It brings transparency, rigor. It helps build solid, evidence-based practice that actually improves things for you.
That's a great analogy. Building without a blueprint, or maybe knowing what you're building but not understanding gravity, perhaps. No wonder some efforts might just run out of steam. But okay, it wasn't a complete blank slate. The review did find a few theories being used. Empowerment theory popped up most often. Still only in 2 co-creation studies, but it was there.
That's right. And empowerment theory is, well, it's fundamentally about people gaining understanding and control. Control over their own lives, their circumstances, to improve wellness. It makes sense in this context, doesn't it? It helps explain how genuine participation can lead to people feeling ownership, agency. The studies mentioned used it, for instance, when looking at youth-led research, where young people weren't just consulted, they actually led the process. They identified the problems, they drove finding solutions. That's empowerment in action.
Yeah, you can really see the connection there. That's powerful. And there were a couple of other interesting examples too, right? Though less frequent. Things like combining social learning theory and narrative theory. Using photo stories, I think, for health literacy, making health info more accessible. And social innovation theory was used too, looking at how community co-design health services actually, grow and develop through diverse input.
Exactly. And in those few cases where theory was used, it wasn't just mentioned, it actively shaped the research. It informed the methods, how things were evaluated. It provided that clear framework, that blueprint for understanding why things were happening the way they were. It allowed for real insight, not just watching stuff happen.
Okay, so let's wrap up this deep dive. The main takeaway seems pretty clear. These co-approaches, co-creation, co-design, co-production, they hold fantastic promise for public health. Huge potential. But there's a definite need, maybe an urgent one, for more explicit theory, to really ground them and make them consistently effective. Move beyond buzzwords.
Precisely. Future work really needs to build on those few theories that were identified. And crucially, we need clearer, agreed-upon definitions for these terms so everyone knows what they're talking about. That strengthens how they're used, how they're studied, and ultimately how much they benefit you and your community.
So here's something to think about. When you look at collaborative projects, maybe in your own work or your community, how am I asking, what's the theory here? What's the underlying why and how? Actually strengthen the whole thing? Could it lead to deeper, more meaningful participation for everyone involved and maybe more lasting results worth considering?